Here at Cross County Cardiology, each patient is taken with individual care. We specifically go through their symptoms and concerns and then tailor their treatments specifically to what their needs are. We ensure that we review all the information about the patients prior to them coming so that when they're in the office to discuss their situation, we already have the background of why they're here and what tests they've had previously. We then are able to focus our time with the patient on tailoring their treatment and diagnostic plan so that we can maximize their care. I think that it's very important for patients to focus or understand what they're receiving. A lot of patients have concerns about their medications. Many patients come to us because they've been to other cardiologists and didn't understand the care that they were receiving. They really want to know what it's about. They want to understand why the treatment is appropriate and what potential downsides there are to the treatment, but also the upside of the treatment. And I spend a lot of time with patients explaining to them why their therapy is necessary and how it's going to work. So I use multiple modalities to explain to patients about their health. I'll often draw things on a board and explain things on diagrams. I often show patients videos of online cartoons of situations that they have or specific procedures that they have. We review with patients their diagnostic tests, and I, in the room, will see the echocardiogram with the patient and also show them their nuclear images. So we spend a lot of time trying to explain to patients how the information we've received relates to them. So adult cardiology is often a combination of treating the patient, but also involving the family in their care. Many of our patients are elderly, and oftentimes we have to incorporate their children in the decision-making as well as the testing that's being done. We have to look at their cardiac care in the context of their overall health. Many of our patients are seeing multiple other doctors. We have to see what their treatments are for their diabetes, for their kidney disease, for their other medical conditions, and we spend a lot of time integrating our care to their overall care. And I think that's a big challenge and a big part of how we practice medicine. Preventative care has now become the real focus of what we do. I always tell patients I enjoy more taking care of a patient before they've had a heart problem and preventing it from ever occurring than fixing something once it's happened. We have many diagnostic tests that we now use to evaluate whether patients are at risk of disease. A lot of our treatments are now focused on prevention rather than treatment. So we spend a lot of diagnostic tests to look to see whether patients have early signs of disease or disease that has not yet manifested in symptoms but is potentially harboring an issue 5-10 years down the line. And that obviously includes lipid therapy, but also preventative therapy in terms of lifestyle changes and ways of adjusting their exercise, diet, and so on. So prevention has become a real focus of how we practice. So we all have our own individual expertise. I am a non-invasive cardiologist and I specialize in nuclear cardiology and echocardiography. We have an interventional partner. We have another partner who is into other non-invasive diagnostic modalities for peripheral disease and carotid disease. We all see patients, we all take care of clinical situations, but each one of us has a specific expertise in a subsection of cardiology, and as such, we all share in how we do the diagnostic tests and share information between us. We make sure that the patient is taken care of by one specific person, one doctor that is your doctor, and we keep to that, but we do diagnostic tests. You get the advantage of having a team approach and having an expert to read your studies. We have many patients that we take care of who are I'm very fond of and have taken care of for a long time. I think one of the most interesting experiences I recently had is I saw a young gentleman who came to me because of some palpitations. After a few minutes, I realized that not only had I taken care of his parents, but I'd also taken care of his grandparents and his great-grandparents. So taking care of families in a holistic way and in a caring way is part of what I enjoy the most about practice and how I enjoy doing my daily work.